Oh, the baby cages. Oh.
First in the shower, so I just put it on her bed.
Oh, awesome. How are you guys doing?
We're good. How are you?
Good. You guys have a bolster too?
What?
You have a bolster too?
This?
Uh-huh.
This is yours.
You're right, it is. Yeah, because I left it there. You brought it. That's right.
Yeah.
Oh, thank you. You're so nice. How are you doing?
Good, Auntie. I like your scrubs. Those are cute.
Thank you. How is school?
Oh my god, it's so stressful right now.
Cool.
Yeah.
Thanks for letting me do this massage thing with you.
Yeah.
So, you are today. We're gonna give you a stage name. I'm gonna put like a blur out face, okay?
Okay.
But just state your age.
Am I the same age?
Oh no, wait. Yeah, you are older than 18 though, so we know that.
Yeah.
Okay, cool. And then the date.
So my age and the date?
Yeah.
So I can say I'm 20?
Yeah.
Okay. 20 and it's the what, 14?
Yeah, of November.
14.
Okay, cool. And I'm gonna blur your face too. Okay, so we're gonna go from the beginning, okay? So I wanna do it like a regular thing.
Mm-hmm.
We're gonna just call you like, what should we call you?
Brooke. No.
Brooke!
No.
Okay, Tiara.
Tiara. Okay.
We're gonna call you Tiara. Okay,
Tiara.
Tiara, age 20. And then you have, you're a student, right?
Yes.
We'll have similarities with your own, conditions. So, what brings you to want massage? You've had massage before, right?
Yeah.
And it helped?
From
Okay.
you.
Okay, yes, that's right. It was me. Thanks, Bailey. So, all right. So, do you prefer lotion or oil?
Either one.
Okay.
Doesn't matter.
And are you okay with a full body massage?
Yeah, that's fine.
Is there any areas to avoid? Like, do you have any cuts or bruises or tender spots?
No,
Okay.
just get attacked by patients, but everything's
Oh,
closed.
dang. Sorry to hear that. That looks terrible.
I had a giant wrap on it actually for 4 weeks.
Jeez.
Yeah.
Do you get extra credit for that?
No.
Awesome. Okay, cool. So you get to be the first person on my new table, alright?
Okay.
So that is an old injury. If it starts to hurt, just let me know.
No, it's all scar tissue now.
Okay, yeah. So with any soft tissue, it's going to take like 4 to 8 weeks anyways
Yeah.
to completely heal. And then it's still going to be healing beyond that, depending on how bad the
Yeah.
injury is.
It was bad at first, but it's
And it's possible you even got a stress fracture out of it. You didn't even know, you know?
maybe.
Because, you
I had
know.
to get a shot though.
Oh, did they have rabies?
I don't know, but I had to get a shot because of whatever reason. So I
Oh.
was like, okay.
Dang, sorry to hear that. Okay, cool. So, whenever you're studying, how many hours a day are you studying?
Like 5 to 6.
5 to 6?
5 to 6 every day.
And are you, oh, dang, that's a lot. Are you sitting down while you're
Yeah.
studying? And how often do you get up to go?
Not often.
Okay, well, let's start with that. Where are you feeling your pain and how often do you feel
My
it?
back.
Your back? Like
Always.
the whole back?
The whole back, but more so like my middle to lower back.
Middle to lower back?
Yeah.
Okay, not so much in your upper back?
In my upper too, it's just worse in the middle. to
Okay,
lower.
and is it more like a dull, achy, hot, burning,
Like
sharp?
achy. and
Achy?
Sharp.
Okay, but does it feel better when you do anything?
Maybe whenever I stretch.
When you stretch?
Yeah,
Okay,
when I
cool.
stretch.
And then what's your preferred stretches?
Like downward cat, like
Oh,
cat stretch.
awesome, you do
Yeah.
yoga.
Yeah.
Cool. So I know you're studying right now and you're pretty stressed. Have you been sleeping well?
No, actually, not at all.
Oh, I'm so sorry to hear that. Are you hydrated? Do you drink
yeah,
enough
I
water?
drink a lot of water.
Okay, that's good. Cause also the weather here is pretty crazy.
Yeah,
So, and then let's see. All right, so okay, we got your back pain. I'm not gonna have you point to it because it's pretty specific. It's pretty general. It
Yeah.
sounds like it's just all due to like your posture.
Yeah.
For that, we're gonna do massage. But what you should do is when you're stretching, start getting a resistance band and then just pulling it outwards.
Outward?
Yeah. And then also stretch the pecs,
Mhm.
your shoulder. It'll stretch your shoulders because when you're forward head carriage for that long, you're actually compressing your nerves and your arteries because they all run together, the vein and the artery. So all your nerve supply, your lymphatic supply, all that circulation is getting compressed and shrinked, and then you're also stressed, so it's also vasoconstricted. So you're not getting that much nutrients in or out.
Yeah.
And then that causes ischemia in your nerves, yeah, and then your muscle tissues, and then all your myofascial as well.
That's a good word.
Yeah. You look good. How's it been going? Have you been helping with the twins too?
Yeah, all the time.
See it, and you're
all
doing
the time. Late at
all
night,
that.
early in the morning.
Oh my
I wake up
god.
at like 3 in the morning every day.
Oh my
and I don't
god.
get home until like 4.
Oh, I'm so sorry to hear that. That's terrible. So I'm gonna give you a massage, and thanks so much for volunteering, Tiara. So what I'm gonna do is I'm gonna set up. I'm gonna wear this. I'm gonna try using. I'm gonna have to set up my other phone. But then just talk to me about what's going on. Like, how are you feeling overall with everything?
Just stressed.
Okay, cool. We are gonna work on getting you on a less stress. Okay, the massage will be great because it's a systemic massage.
Yes.
Yeah, and we're doing full body, and we're gonna focus mostly on your back, and then you're gonna stay hydrated. You're gonna try to get more sleep, but I understand that you're stressed and that. But at least we'll be doing that. And then do your stretches, do your little resistance band exercises. How's your workouts going? Pretty good.
Good, yeah, I walk a lot.
Awesome, cool. Are you on any medications right now?
I'm supposed to be, but I haven't taken it yet.
What is it?
The Torvastatin.
Oh, what is that like?
It's a Lipitor for my
Oh,
cholesterol.
you have high cholesterol.
Yes.
Okay, so if you get dizzy at any time, or is that the only thing you have? Do you
Yeah.
have high blood sugar or anything like that? Not
Everything else is fine.
not pre-diabetic or anything like that. All right, cool. How's your digestion? Pretty good. Digestion?
Yeah, my digestion's pretty good.
All right, cool. Awesome. Is it okay if I play spa music while we go?
Yeah, that's fine. Do you want it on your phone or do you want it on the TV?
Oh no, I'll just put it on the. Can we turn that off?
Yeah.
Sorry.
Yeah, you're good.
All right, cool. I'm just gonna music off of this phone right here. Yeah, so it's going to be a parasympathetic response. We're going to get you into increased rest and digestion. So it's mostly going to be rest and relaxation, which we plan to have you snoozing into it, okay? That means I'm doing a great job and that you're relaxing. Just because, it's part of the parasympathetic response. And it means your body's healing and it's listening to everything that needs to be done. Alright, let me put this back on silent too. Okay, and I'm going to play some spa music. Is that okay?
Yeah.
Cool. Do you have any preference?
No, honestly, anything's fine.
Okay, I've been listening to lo-fi hip-hop. I might be getting kind of tired of it because it's the same stuff, even though they mix it around.
Yeah.
Okay, but that'll just be our music one. And then, let's see about, I don't know how to start this. Maybe I just, talk into it? Hello. This is so weird. Thank you. We're going to go over how you feel afterwards too, okay?
Yeah.
Just to see. I'm going to check it. You're the first one to use it, right? You massage table.
It looks nice. The packaging is very.
30 pounds.
Really?
That other one was 54. So
Oh, really?
Yeah, this is way lighter.
It looks bigger though. Like whiter?
Oh no, it's the same. It's kind of the same pattern, I think.
Oh.
But
Was the other one red?
oh no, I think I gave you the red one.
Yeah.
Oh,
I
this
did
one
have the red
is bigger than that one.
Okay, yeah.
I have.
That's the one I was referring
Okay.
to.
If you ever need a massage table, I have two extra.
Oh, really?
I have another big one like this, but it's a heavier one.
Yeah.
But it has less padding. But this one's used more firm.
Yeah. I like the
$600.
color. Are you serious?
Wow. I mean, for tax. And I was like, is it even gonna be worth it, Because I'm like, seriously? But then it's so light, And it's cool. Alright. Yeah. So it's so light. Look at this. Aluminum. And it is, right? It's a low table, and this is how you set it.
Yeah, that's fine. Do you need me to move anything?
No, you're good. Alright, so that's where the head cradle is going to be. What you do is you just put your foot like this. Oh, wait. I'm just waiting for this camera.
Yeah.
Because, like, when I look up, I'm not sure. Okay, yes, so you just put your foot like that, and then it goes. Pretty cool. Yeah. Alright, so... we'll cover you. We don't have to have, whenever you're on the table, so... I'm gonna have the covers here, but you can just... Do you have a towel?
I can grab one.
Oh, okay, great. And then I'll just set this up too.
Okay, I'll be back.
Alright, awesome. Thanks. Oh yeah, that was fine. Yeah, perfect. Just something you can like, cause you can keep your shorts on, okay?
Yeah.
Although I do need to get to your low back, so you will have to tuck them into your underwear. So, all right, thanks. And I have some eye pillows too.
Okay.
I'm just gonna put this ball here. And these are clean. I was thinking if I should use a tripod, so I brought it, but nah, too much stuff to do right now. Oh, thanks. Yeah, that's clean too. I was just gonna put this on it. What time's your bedtime normally?
I usually don't fall asleep until like 1 or 2.
Oh, okay, good. At least I'm not interfering with anything.
And I have to do a few things after this because I have to bake some.
Oh my
My classmates want to have a Friendsgiving, and then Brooke wants to do things for her friends, and then I have an order for Saturday of like 50 decorated cookies, so I have to do that.
Oh my god, girl, don't have a heart attack.
I know.
You're like really
I know.
overworking yourself. Alright, well you're doing great.
Yeah.
Hey, that's some extra money.
We're figuring it out slowly.
Are you doing it for free?
No.
Oh.
I just did it for cheap because it's like my classmates and my mom's coworkers.
Awesome.
So I'll just do it, so I'm just like, okay, sure.
That's so nice.
Because I have bills, so I'm doing it all.
Aw. Mommy doesn't.
She did it for a bit.
I'm just kidding.
Or-
I'm sorry, Bailey.
Yeah, I don't know, like my phone bill, is your phone bill super expensive? Why is mine so expensive?
No, mine's like $135 for 2 lines.
Okay, I'm only paying for my line, just me, and it's like $158 a month.
Why?
I don't know.
What are you getting from it? It's just
AT&T.
Does that include the price of the phone too?
Maybe in the monthly payments, hopefully, because I had to get a new phone, you know?
I think that's what it includes, yeah.
So I was like, why is it so expensive? I didn't know if that was normal.
That's really pricey.
Right? And I'm like,
Okay, so what I'm gonna do is you're gonna get undressed, but I'm just gonna move the camera so they're not looking at you. And then remind me to move them back.
okay.
Okay. I'm gonna put this right here too. Alright, so I want you to relax, but at the same time, I'm wondering if I should talk to you about your muscles, you know?
Yeah.
Like, oh, this is your, but
Good.
are you guys doing anatomy and all that stuff?
I've taken it.
Okay, yeah, I'm gonna talk a little bit, but try to, like, tune me out, okay?
Okay.
Cool. And then this will be your eye pillow for when you turn over.
Actually, if you go to my arms, the top of my left arm, because I just had to get a flu shot like 45 minutes ago.
Okay.
So
45 minutes?
Yeah.
That's what you're at Target?
Yeah.
Oh.
Because I had to get a flu shot, so I was like, that's
Hmm. Okay, sounds good. Let me know when you're ready. You're gonna be under the covers too, dear.
Okay. Oh, under this?
Yeah. Thank you. Yeah. It's just because we're doing a full massage.
Yeah.
Wait, they can't see anything, right? Are those like screen darkened?
Oh, yeah, they're darkened.
Okay, cool.
From the, like, outside in.
Alright, awesome. Okay, let me know when you're ready.
Yeah, you should be good.
Alright, I'm gonna move the cameras back. Cool. And then this
I
one.
didn't know what to do with this towel.
Oh, okay, you can leave it there. Or I'll bring it. I'll put it back for you. Wait, hold on. I'm just trying to get it. Okay. Actually, I'm going to put this over here now. Remind me, okay?
Okay, yeah.
Alright. Impressions. How's the pressure? Pretty good?
Yeah, the pressure's good.
Okay. I'm going to start with some acupressure, okay?
What do you want my arm? Down?
Oh, you can keep them right there. Acupressure is pretty relaxing. We're just going to do it right along your erector spines.
Okay.
And they go all up and down your low back, your thoracic back, and then your neck. And they're what keep your posture fine. So this is like the first thing we learned, actually. Let me know if it's too much pressure, okay? And you just hold it for 1 or 2 breaths. Just breathe regularly. Great. How's that pressure? Is it okay?
Yes, good.
Let me know if you have any tenderness, okay?
Okay.
Good girl. What happened with your EKG?
So it came back normal.
Oh,
I
great.
think the reason that I was having that tension you're talking about was probably because my cholesterol.
Oh,
It's going to my arteries into my heart.
yeah, that can happen. Are you on birth control too?
No,
Okay,
never
because
been.
that can also do stuff cardiovascular wise.
No. And my blood pressure's gone back down. So I've been
Awesome.
trying to eat better.
Oh, nice.
So.
Oh, I can feel your pulse right there.
Really?
Yeah, that's really. Let me just make sure.
Is that normal?
Maybe I was feeling my own thumb pulse. It's not. That's why I was like, that's not normal. Okay, I don't feel it. I think I was feeling my own thumb pulse.
Yeah. My thumb.
And if the thumbs get tired, you just go like this and use the knuckles. But be careful when it's over fabric because you will make sure you're hydrated because your skin can start to abrase, yeah?
Yeah.
How are you liking it? Is it okay, Bailey?
Yeah.
Alright, great. And just breathe normally. I'm glad you're healthy. I'm really glad.
Thank you. You too.
Thank you. How is it? Is it comfortable?
Yeah, it's super comfortable.
Alright, cool. I'll probably start bringing a electric blanket with it.
That was cool.
Yeah. I'm gonna use the thumbs on your neck though, okay? And there are erector spinae muscles around each vertebrae, but your neck is actually a pillar, so you have these muscles on top of your pillar because the way that they're aligned, they're so tightly knit right here that I'm going right into your muscle. You won't see any vertebral movement, especially since you don't have any bulging discs, right? From trauma, because you were hitting the head pretty hard.
Yeah, I don't think I do things for.
Oh, okay, good. Because I remember, like, when you were in cheer,
Yeah,
girl.
it's bad.
Poor Bailey. I mean, poor Tiara. Poor Tiara. Little Tiara. Now we're going to do the next layer. There's 3 layers, okay? And this is really going to help with attention. So all around the vertebrae, you have ligaments that connect the spinous process, the back part of it, to each other. And then you have interspinous processes that connect between the spinous processes and the vertebral bodies. You have lamina inside it that hold the vertebrae together. These are all stabilizing the vertebrae. Yeah. And you have like 6 or 7 different ligaments stabilizing each vertebrae in place. You got an anterior longitudinal ligament in the front, which prevents hyperextension. And then you have the posterior longitudinal ligament, which prevents hyperflexion. That one lines the back of the vertebral body and the front of the spinal cord canal. Your spinal cord is in cerebrospinal fluid all throughout your spinal column, which is built by each vertebrae. So you have 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae, a sacrum, and a coccyx. And these are all part of your spinal column. All of those regulate your central nervous system, spinal movement, your functional movement, your skeletal structural movement. And the nerves come out each disc coupled set. So between them, they're housed by facets, Z joints. Whenever you move, you release synovial fluid around the joint capsules, which is like a ligamentous tendinous structure that has synovial fluid. And synovial fluid is the only way that you can nourish your joints so that you prevent degeneration of the hyaline cartilage, which lines the bony end plates, and then the meniscoid type disc between the facets. They have a little meniscoid as well, which is fibrocartilage. It's a little bit more durable than the hyaline cartilage, but they prevent bone-on-bone sliding, which could lead to erosion and arthritis. And once you get there, you need either like some plasma-rich protein injections, or just a replacement, or just scar tissue to build up, but then you won't be able to have that much movement around it. Yeah, I know, crazy, right? But that's why people get adjustments, because they don't move, and then some of these stuff stays immobile. But you can also get as close to the joint with soft tissue massage. The adjustments take it beyond the soft tissue, which we can take it to a stretch range, its end range of movement, and then bring it back to initial stage and then back to that one. But for adjustments, they go beyond it just slightly, because they want to stay in the same range that is elastic, so there's no damage. If they go beyond that, then it turns into plastic destruction. And plastic destruction means there's going to be some damage. Yep, something's going to absorb that damage. It could be damage to the bone, it could be damage to the joint, it could be damage to underlying soft tissue. With any soft tissue, if you are really stressed out, it's good to stay hydrated, stretch, do some exercising, because mechanoreception of exercising, that is actually going to block and inhibit pain faster than if you were to use ice or heat. Yeah, it's interesting, huh? Yeah. And then also, if you ever find yourself itching from all the stress, drink some water and then stretch as well, because itching is a stress response, and it can be associated with edema as well. Yeah, because whenever you scratch it, you're actually, that's why dry brushing works, is because, it stimulates your immune system, because that's how your lymphatic system works. So it's gonna take all those proteins that leak out into your soft tissue, and whenever you're really stressed, you might get inflammation because of the stress, and then what happens is you just do like this, and your lymphatics, which go all around the interstitial space, they're going to bring all their B lymphocytes, which are immune cells, and antibodies, and they're going to go pick up all of the contaminants that are there, all the stress hormones, reactive oxygen species, and they're going to release enkephalons and such at that level so that you can start to feel better. And you need to stay hydrated too so you can flush all that stuff out. Okay, so I'm going to start the massage now, okay? Let me know at any time if it hurts or you feel uncomfortable. Oh, good thing you're wearing the Band-Aid, so now I'll know for sure. Right now, this is where a lot of people get tech neck. I'm going to tell you when I want your arms up, but actually, yeah, I want your... Can you put your arms by your side under the blanket? Thank you. Okay, so I just am putting lotion on your back just to do an effleurage, and then get a feel for your back. If you have any spasms, you'll show it. If it's cold, I try not to make it cold. So we're feeling all your muscles underneath it as well. You have many layers of muscle. So I'm starting right here. You got your suboccipital muscles right here, deep into the neck. Those are good for head flexion extension, preventing those, and slight rotation and side bending. And then you have your erector spinae in your neck. You also have your spinous processes, the nuchal ligament, fascial layers from the upper trap attachments. And then you have deep in there, you have your scalene, posterior scalenes deep to the upper traps. So they're right in here. The upper traps have attachments. Goes like this onto your... So I'm just palpating right now. So this is your top of your shoulder. This is your acromion process right here. You got your clavicle right here. So it's right here. And then back behind it, you're going to feel for your first rib. A lot of people get pain in here. Your scalenes are in there. Your levator scapulae. Those are good for... The scalenes are going to extend your head back whenever you need to extend it. They both contract underneath the traps. The traps right here, the upper traps, they tighten so you can lift your shoulders up. Levator scapulae, they attach to the superior angle of the scapula, which is right in here. I can feel it. Don't palpate too hard. Make sure you're using a light touch because the muscle will contract and then you might not find it. But you just touch in there and then you can feel along where these muscles are. If you know the layers, the upper traps are on top. They're going to share a fascial layer with the levator scapulae. Levator scapulae all attached to the scapula. Traps right in there. Scapula actually freely moves across these ribs right here, or protracts. We got the rhomboids, minor and major right in here, going to the lower angle and to these spinal organs right here. If you ever have referred pain right here, it could be due to the heart. Right here, it could be due to the pancreas. Here, the kidneys. But it's only if it stretches it. So if you have a kidney stone, you can feel it here, but once it starts migrating, you'll start having it in your front. And you'll start having flank pain right there as it goes towards the bladder, down the ureters that are going through your abdomen, to your ureters, to your bladder, in the center, right above your pubis bone. And then back here is menstrual cramps. Yeah, you can get menstrual cramps right here. Also constipation cramps as well. So, because it's all pressing right there. But the nerve supply too, because it's going to be the pelvic splanchnic nerves down here that are supplying the blood and the nerves supply to those visceral organs. Up here, it's like we have the splanchnic nerves. Wait, no, they're the sympathetic chain. Yes. So you got the cervical, thoracic. You have the lesser, less, and greater. And those are right along the spinal column. But let's palpate for some knots. You are young. You're only 20, Tiara. Mm-hmm. So, not a bunch of tension, which you don't expect in someone your age. Plus, you don't have autoimmune conditions or anything that would make you have a... Plus, you work out, too. So, that's good. Nothing superficial, really, yet. So, this seems to be all just, like, muscular aches. Because I can already feel your ribs, surprisingly. You feel it? Yeah. I can palpate your ribs right here. Here's your spinous processes. And right in there, right next to the spinous processes, you got some tendinous ligamentous structures. The facets are going to be right around it. They go in a certain direction. It's about 60 for the cervicals,
45 for the thoracics, and then it goes into 90 for flexion extension as you get down, and then it goes into 180 for the lumbosacral joint right here. If you ever do any strenuous work like deadlifts, a lot of weight, and then you're getting like bulging disc, it's going to happen right in here, and you'll get sciatic pain. That supplies the sciatic nerve all the way down your leg. Some people, they can't even sit, so just be aware of that, okay? But as long as you're holding your core and maintaining it, you're good. And if you're not doing too much weight.
Yeah.
You can also get it from repetitive loading too. You know, if you're ever going to lift weight, do it standing. Don't do it seated, okay?
Really?
Yeah, standing will be better because you put the most tension on your low back whenever you bend over seated and lift weight up. I don't know why someone would do that, but they, yeah. Yeah, it could also be like if you're hunched over and then you're lifting a lot of weight. Yeah, and then not engaging your core, I suppose. How's the pressure? Is it okay? I'm adding a little bit more pressure, and we're seeing a little bit more blood flow. It's kind of a pink color coming up. That just means that we're working out, increasing circulation. You're relaxing your splanchnic nerves and your sympathetic chain. Sympathetic chain goes all around here. So you get the T1 to T12, and then L1 as well. So if we can get some pressure in here, relax all the musculature, relax all the compressive muscles, get them not to be as tight, you're going to go into a parasympathetic response because those are going to be blocked out, and it's not going to have a sympathetic firing. You got your respiratory centers in your brainstem and your medulla oblongata, and your heart rate monitor and your pulse monitor as well. You also have them in your carotid arteries in the front, which breaks forward. Right in here, we're massaging the scalp. The scalp is very sensitive to electromagnetic frequency. Because when I wear this dash cam thing, this head cam, I notice that I have electromagnetic frequency as well. That's why a scalp massage is really beneficial. It will stimulate blood flow and cerebral spinal fluid. Cerebral spinal fluid will nourish the brain and the neurons in a parasympathetic state. It'll go down your spinal canal. The spinal cord actually ends right here around L1, L2, and then it goes down and it divides into a tail so that your nerve roots inside the spinal canal. The cord ends here, so anything above here is considered central nervous system lesion, and then anything below it is a peripheral nervous system lesion. So from L2 to like C1, coccyx 1, which is, there's 5 lumbar vertebrae. I don't expect to get you to know this all at once, but it'll become very familiar to you.
Sleep medicine or an elbow.
Oh. I can feel your skin getting dry, so I'm going to add a little more lotion. Is that okay? Did you feel that too?
No, that's fine.
Okay, because it was tugging on your skin a little bit, huh? That's okay, it happens, especially in this kind of weather.
Yeah.
And then when someone's not hydrated, I don't know. Some people just have really dry skin too. You don't have really dry skin though.
That's good.
Yeah. Yeah, it's really. You're healthy. Good. Keep doing great work. So in here we got your QLs, which are quadratus lumborum. It's going to attach to the end of your thoracic spine right in here, which is right here, right around where your bra line is. It looks like you had a bra line right here, or your tube top line. Oh, so your quadratus lumborum together, both sides they contract so that you can extend backwards along your lumbar back. Unilateral, it's for side bending, like here. So they just go, they're like little fingers wrapping in, and then they just contract. And then deep. On this level, deeper, or in here, and then more in. Wow, you have some tight toes. I told you to right? Yeah, so your psoas are going to be also that right there. I'm just trying to feel where you're. Okay. So your shorts are going up above your. Okay, that's fine. I'll just leave them right there. But your psoas is going to be right. No, it's okay. It's fine. Don't worry about it. I'm just going to press in here and it helps to release your psoas. Is that okay? Yeah. Okay. Because your intestines are going to be further up. And your aorta, because your psoas is so dense, it's going to be way out of the way. Because your vertebrae are still in there too. They're pretty thick too. So the aorta is right in front of your vertebral column. Yeah. And this is where the sympathetic chain ends. Is that hurting? No. Okay, cool. And just breathe normally. Let me know if it hurts. Don't tell me it doesn't if it does, okay? Okay, cool. Some side effects of massage include a little bit of muscle soreness. Not everyone feels that though, okay? Yeah. That's only if they have like deeper work, you know? Yeah. Nobody really gets it from acupressure because it's only going through here, and this is like your thickest layer. If I had to go through so many layers, there's like 6 layers. Yeah, on top you have your traps right here, and then you have your lats right in there underneath it, but you also have your rhomboids going through here, so you got your traps, your rhomboids, the erector spinalis, and then you have the semispinalis deeper in there, and then you have all the little ligaments that attach in between, if this is the transverse process of one of those vertebrae. And then you got the ribs, you got the intercostals and the external costal. Sorry, was that too much pressure? No. Okay, cool. Sometimes we add an elbow. She's not ready for an elbow yet, though. Can see some circulation, a little bit of pink. Not really red, not flushing, but it's good. Getting some improvement. That means it's working out toxins and bringing in nourishment. Mm-hmm. I prefer to do the thumb stripping. You've noticed that so far, huh?
Yeah.
So those are my go-to moves. Occasionally when I'm done stripping it a little bit, all these tissues, because it lets me get into the deep layers of the muscle as I work through. Getting to the erector spinae, here we go. We start with your QLs, and we're going up the strip, getting into your lats, lower traps, upper traps, rhomboids, and upper traps. Levator scapulae, right in here. Right here is where you feel a little cliff fall off, because that's where that levator scapulae is. And if you bring all this tissue all the way to the front like that too fast, it has nowhere to really go, and it just jumps off, and it can be a little knot that can be irritating to some people. So I like to kind of massage it right there. How do you think?
Yeah, I think so.
Okay, cool. And so we're into the levator scapula. You can see because we got like the spine of the scapula right here. Forward head carriage happens a lot. It torques this levator scapula. Get into your scalenes. Your sternocleidomastoid attaches right in here. We'll get to that when we get to the front. It attaches to your manubrium in the front. That's responsible for turning your head. So let me get to your... I'm going to sit on this couch. So when we get into your scalenes right here. So this is about the midline of your neck. And then all the nerves are going to go through here. And then they go under. I just palpated your clavicle. Right here is your clavicle. They're going to go under your clavicle, out the other side, under your pec minor. So actually they're going to go under your clavicle. It does go under your pec minor, deep under it. And it's also under that coracoid process. It's going to go into your axillary, your armpit right here. Is that hurting? Sorry.
No.
Okay, it's going to go out there. And then you're going to have it wrap around right here. Feel that? Teres minor.
Yeah.
It's a little, it wraps around right here, one end, before it goes through the axillary armpit on the front. It's going to supply the triceps right here. And the extensors, here's your thumb. The extensors right here. And it's going to go through here. It's going to be responsible for your middle finger, which is C7. And then this right here is the median. It's from the front for the functional properties. And then, yeah, when you get to the front, when it goes through the armpit, it's going to cross right here. Pronator teres is the median nerve. You got two heads right there. And then right here, the carpal tunnel, it's going to supply the thumb, finger, half of that third finger. Then you got the ulnar one too. It's going to go on the pinky side. So it's right in here. It's going to go down. And right here, it can get trapped. It can get trapped right here, the cubital tunnel. Right here, if I'm studying and if you're sitting on your elbows too much. Down right here, that's the tunnel of Guyon, right here. Right where the hamate is, and the carpals are just right here. Just this little row. That's your carpals. You got 2 rows of them too. And so it goes under here, and it supplies these 2 fingers. So if you ever feel paresthesia or numbness there, it's ulnar nerve, lower brachioplexus.
That happens to me.
Oh, dang. Then it could be from sitting on your elbow, or it could be from right here. Bike riders do it when they sit on this end too much. Yeah. Oh, that bag. Sorry.
My wrist snap.
Oh, your wrist pops too?
Like,
Oh, okay. I'm doing the kneading now. This is the kneading. These are the calmer ones. So this is like a patrissage for really light. This is for lightest. This just stimulates. And if you do the dry brush, you can see how like it almost is like itching. And that's going to stimulate protein uptake. Protein waste that's leaked out into the body tissues and is causing leakage to balance out those proteins against the cell proteins of the red blood cells. So that's why people get edema, and it helps clean up the edema because the lymphatics are basically, they're saying this movement right here is stimulating the Ruffini itch receptors, and when those stimulate it, it knows that there's something there. So the lymphatics are going to go out with their B lymphocytes, and they're going to say, okay, we get it. There's something here. What is it? Okay, you want me to clean even more? Okay. So they're going to pick up all that dead waste, bring it to their lymphatic cells, up to their B lymph nodes, all along the spine right here. They run with the arteries and veins because they need movement. And so the left side right here is going to empty out from the right side. The right side. Yeah. It's okay, thanks, Bailey. So the right here is going to empty out into your subclavian vein. And then the whole rest of the body, everything, empties out right here at the thoracic duct. Yeah. But you have to make sure that you're hydrated. Mm-hmm. Over your band-aid. Sorry about that. Okay.
Just a little tender.
Sorry.
Arm is weird right now.
Yeah, it will be because of the flu.
No.
You get a subcutaneous injection, right? Wait, what is it called? Subcutaneous, that's right. But isn't it called something else whenever it's muscle tissue?
Intramuscular.
That's right. You get an intramuscular injection. Smart girl, Bailey. modest. I'm just going to redrape you again, okay? So we just take it from the corners. We're going to cover the top cover, just covering their gluteals. We're going to take it like here. We're just going to, we can either lift the whole leg like this, but never this. I hate when people do this, because I'll be doing this. I want to lift your leg up, Bailey, and act like you don't want to lift your leg for me, but you just want to kick me up like this is going to make it easier. Okay, kick up your heel. Yeah, so they always do that, and I'm about to do this, and then they kick me in the face. Yeah, or in the shoulder with their dirty foot.
That's horrible.
Yeah, and it just added more weight to it. Now I have to pick up the whole leg, you know? Yeah. So like you just pick up this knee right here and it just goes in. So anyways, we just take the blanket like this. We're gonna take it right here, grab it below the knee, and then we're gonna pull it right here. We don't want to burn their skin. Don't roll up their actual clothing, but just bring it to below their clothing. And don't go into their pelvis. And then some of them like to lift their hip up. I'm gonna just tuck it right here and then hold their body down like that, just so it secures it. It's supposed to secure it. How's that? Is that okay?
Yeah.
And I just like to get into that trochanter right in here. That's where the gluteal muscles attach. Just rubbing. So I'm just getting in here. You can palpate the trochanter right here. So it's gonna go up right in there. The glute max, the TFL, the glute median, all of them have attachments right here. The piriformis, superior gemellus, inferior gemellus, obturator externus. All of those are hip external rotators. They're necessary for squats, getting up out of a car, hip hinge, all that stuff. And then we use some lotion. Make sure it's warm. Tiara, y'all ready to scoot down and turn over? And then I'm gonna close your eyes so I can put this eye pillow on you. So I want you to scoot down too so your head will be on the table. I'm gonna lower this face pillow. Perfect. Okay, close your eyes. And I'm gonna put this eye pillow on you. How are you feeling? Okay?
Yeah.
Alright, let me put this bolster under your knees though. Comfortable?
Yeah.
Alright, perfect. Yeah. All right, Bailey. You're feeling pretty good?
Yes.
Awesome. Well, thank you. I'm going to take these cameras away. So you're feeling pretty good?
Yeah.
All right, let's just see. Where do you feel relaxed at? Do you feel like you need to like move your neck around or anything like that?
No, I feel good. Like everything feels good.
Awesome. Cool. So you're feeling good?
Yeah.
Like when you move your arms up and stuff? It's fine? All right, cool. And you feel like you're getting circulation and stuff?
Yeah.
Cool. Do you look at the light or anything like that?
No, I think it only because I just opened my eyes for the first time in a while.
Okay, cool. Well, thanks so much.
Thank you.
Thanks for being our vlogger assistant.
At the end of the massage, it is a good idea to discuss what pain complaints or discomforts were addressed and how client is feeling after the massage, relaxed, tired, sleepy, wonderful, etc. Remind client of wellness plans and ways to improve sleep, hydration, stress reactions, exercise, body positioning when stressed at a desk, and so on. Do offer encouragement and motivation to continue with their wellness goals and regular massages 1 to 4 times per month.
Thank you for watching. Please like and subscribe to this channel for more massage healing videos.